to put it in plain English, we see borderline personality disorder as having as a condition that has 4 areas of difficulty. First of all, emotions. Extreme and rapidly shifting emotions. Life is like an emotional roller coaster. Second, relationships. Relationships tend to be chaotic and conflictual and difficult and unsatisfying and frustrating, not harmonious and continuous over time. Third, acting out behaviors. These can be impulsive, not always impulsive, but often impulsive behaviors are often self-destructive. Things like cutting or overdosing, could be substance abuse, promiscuous, dangerous sex, some form of eating disorder. And I always emphasize that since these are the most dramatic manifestations of the illness, I think they get the most attention, and often people think that is the illness. But we see these as the outer signs of an illness. As other people have said, these are actually attempts to cope with the illness. They're attempts to feel better. They're not the illness itself. So what is the core concept for us? It's the 4th area of difficulty, which is a person's sense of identity. The way we understand borderline personality disorder, people don't have a coherent, integrated sense of self. They have a very fragmented sense of self. They don't have a sense of continuity over time. They're very reactive to whatever happens in the moment. So a trigger event can lead them to the depths of despair, or something good happens and then they're elated. There isn't this kind of sewing together of the different parts of the person into a kind of solid foundation, so that they tend to be reactive to what happens in the moment, kind of like a ship at sea without a keel. So whatever happens kind of really sort of tosses them in this direction or that direction. And without a clear and coherent or cohesive identity, it's hard to know how to navigate your way through life. If you don't have a clear and consistent set of goals and values, everything becomes very distressing. There's often a concomitant sense of emptiness inside, which I think is one of the most distressing parts of the condition. So to get back to the answer to your question, we would see the lack of a coherent and integrated identity as the core feature